Good morning. It is September 19th, and as always, there's a lot to talk about. Congress, will they or won't they keep the federal government open, and what does it mean if they don't? Are they going to extend those Affordable Care Act marketplace subsidies? More information. Federal advisory committees are moving to change vaccine recommendations. Find out how states are responding, including Wisconsin. There are new signs that federal grant conditions are being reworked in ways that limit who can apply or justify money that's already been awarded being clawed back. There's increasing rhetoric in this public space that this is just devaluing people with disabilities. And the reconciliation bill signed into law July 4th is starting to impact states. Some are starting to rethink how they're doing their Medicaid programs, creating wait lists, and eliminating other healthcare programs and services in response. So we're going to start in Wisconsin, as we always do. Last week, we talked about two specific grants that impact students with disabilities, where the Department of Public Instruction was noticed that by the federal government that they were discontinuing those existing grants. And the important piece of that is both of those grants were 5-year projects where the money was awarded in 2023. So these were functions. One grant was focused on improving teacher retention and training, specifically targeting increasing the special education workforce. And the other grant, much smaller, was targeted to providing family support for deaf-blind students. Both of those grants, those projects were supposed to be funded through 2028, and the Department of Education said, we're going to take this money back. So last week, DPI did send a formal letter of reconsideration asking the federal government to revisit that decision, essentially say, hey, we don't think you made the right decision for these reasons. We are willing to make some of the changes that you asked about to, taking words out of the curriculum, et cetera, if you will give us the money that you have that was already promised for these two projects. Interestingly, there is no timeline by which the federal government must respond. So it is unclear, even though the Wisconsin's Department of Public Instruction has said, hey, we're willing to meet you halfway, whether that will be enough to release that funding. One of the grants, they've kind of scrambled to keep it operating, the special education workforce grant, at least temporarily. They've kind of found some patches. The other grant, there isn't any ability to do that. And that's important because, again, without a timeline for the federal government to respond and without knowing if or when that money will come into the state, there's only so long that folks can hold on before they start looking for other jobs and before those existing projects and programs start to kind of, even if you did get the money, maybe the people who were really running them and doing a good job have already had to leave. So it is significant that there may not be a quick resolution. And, even if you do end up getting the money at some later point in time, will it come in time for those programs to be up and operational and running, and as they would have been had the money never been stopped? There are also several other grants DPI is keeping an eye on, I believe 4. They have not yet received their notice from the U.S. Department of Education that those grants will continue past September 30th. They were very clear that for 3 out of those 4 grants, that isn't unusual, that sometimes they have gotten their notice of award on September 30th, which of course is the last day of the federal fiscal year. However, given the recent activities with the administration, I think that there is an increased level of nervousness that, it is unclear whether this is just the normal not getting things out until the very last minute, or if this is in fact a sign that there are potentially other federal grants that are expected and relied upon to fund positions and programs that DPI may learn they don't have. Another thing that happened in Wisconsin this week, Governor Evers issued an executive order that directs our Department of Health Services and our Office of Commissioner of Insurance to do certain things related to vaccines. And this is in response to some of the changes that have already occurred or may occur, in fact, today by various vaccine advisory committees. The order talks a lot about COVID-19 vaccines, but it is broader than that. You may remember that the Food and Drug Administration narrowed who was eligible to get the COVID vaccine, I think last month, which has created a lot of confusion on whether people who don't fit the narrower category of folks that are approved to get it can get it and who has to pay for it. So this executive order directs DHS to think about vaccine recommendations and specifically issue guidance on COVID-19 vaccines, and then take other steps to provide guidance on other routine vaccines. So DHS has said, hey, everybody over 6 months old can receive the COVID vaccine at pharmacies without a prescription. That is a step they've taken. And they have recommended the previous recommendation that the FDA changed so that it remains the same as it has been for the last number of years. So people ages 6 months and older, and that is in keeping exactly with what the professional medical organizations recommend. It also clarified that Wisconsin Medicaid will continue to cover the shot for Medicaid members. The Office of Commissioner of Insurance also directed a bulletin to health plans saying, hey, we expect that insurance will continue to cover any costs associated with this vaccination. So that's the executive order. Now, you may be wondering, why did Wisconsin issue such an executive order? Well, we are not alone among states in trying to figure out a new approach on vaccines. And here are some of the things that have happened. This spring and summer, the Federal Department of Health and Human Services Secretary, RFK, replaced many key scientific members of vaccine advisory committees, both at the Federal Food and Drug Administration, the FDA, and also the Centers for Disease Control, the CDC. And many of the people that were taken off these committees were scientists with a lot of expertise in the study of vaccines, which is immunology, people who were really at the top of their field, and professionally. And some of the individuals that were replaced on these advisory committees are individuals who have known anti-vaccination views. So also this spring, funding for mRNA vaccine research was stopped. That is the technology that helped us develop a COVID-19 vaccine very, very quickly in the pandemic. It was called Operation Warp Speed, and widely claimed across the world as a big leap in technology in terms of speeding up how quickly vaccines could be developed and also distributed. But that funding for that kind of research into vaccines was stopped this spring. And we've covered a little bit before that many, many staff, both at the CDC and the FDA, who had vaccine expertise have fired or left. There's also a lot of research funding that was discontinued at the National Institutes of Health, some of which was related to vaccines. So that's kind of what has already happened. And since there have been changes on these advisory committees, we have seen that the Food and Drug Administration narrowed its recommendations on who can get the COVID-19 vaccine, really just to seniors and people who are at risk of serious illness if they develop COVID-19. That is one of the things Wisconsin's executive order is responding to. And this week, actually yesterday and today, there is a really important advisory committee connected to the CDC, which again now has new members, many of whom have strong anti-vaccination views. That's really influential. It's called the Advisory Committee on Immunization Practices, or ACIP, if you're looking for an acronym. And one of the things that they are talking about today is removing some of the long-standing vaccinations that have been part of the childhood immunization schedule, and potentially the specific talk of one vaccine. They already made a decision yesterday that we will talk about later, and potentially being making some recommendations that would be very different than the recommendations that have been in place for decades on vaccines. We also know that there are some plans to use NIH funding to do research on vaccines, but this time, again, look at the debunked theory of connecting vaccination as a causal or reason that people get autism. So I think there's a lot of reason why many medical professionals are very concerned at this moment that what has been settled science about the value of vaccines is now not going to be the underpinning of federal policy. There are also a number of folks, and you will get links to all of these articles, that are very concerned that all of the things that have happened might just be just the beginning, and that there could be some kind of subtle policy changes to existing liability laws or the vaccine compensation fund that really could dramatically change whether or not manufacturers continue to want to make vaccines, which of course limits access. So one of our friends at Georgetown really did a nice long piece about why is the ACIP recommendations, how does that actually trickle down into state policy? The advisory committee has established what is the list of vaccines that we recommend children get, what's the schedule. And because vaccinations have been such a part of settled science for so long, this committee is actually embedded in our federal statutes. So they are, their recommendations are used by a program that essentially establishes what are the things that states have to cover in programs like Medicaid or the Children's Health Insurance Program. If this is the first time you're hearing about the Vaccines for Children program, you're not alone, probably. This program is the reason why uninsured children, children with Medicaid coverage, and some children with CHIP coverage have access to vaccines. And it is the ACIP Advisory Committee's schedule for pediatric vaccines in the statute that determines which vaccines have to be covered under the Vaccines for Children program, and therefore have to be available at no cost to children without health insurance, children in Medicaid, and some children under the Children's Health Insurance Program. Nearly half the kids in the US are in one of those categories, where the Vaccination for Children's program and by default, the recommendations from ACIP are governing whether or not those vaccines are available to them through the publicly funded healthcare programs like Medicaid and others. So it is an unknown thing. Again, we've never been in this situation before of what happens if ACIP starts removing vaccines or changing recommendations from the long established children's vaccine schedule, which has remained fairly constant for the last 4 decades. So one of the questions this article asks is, hey, Medicaid is a program where states have a lot of flexibility to determine what's covered. What happens when the program that says states have to cover certain vaccines changes its recommendations? Can states decide to cover the pediatric vaccines as they have for the last 40 years under previous recommendations? That's unknown. And I think it's a good illustration of, just how there have been a number of things that have just kind of worked without anybody knowing how in the last 40 years, that now we are in a new space where nobody has thought of, well, what does it mean if this advisory committee makes a change, and how does that change trickle through, because we put it in our statutes to what has to be covered and who. So Wisconsin and other states are trying to figure out this new world. Most of the vaccine recommendations at the federal level have been used by states to establish, their protocols. It's governing what insurance has to cover. It provides liability protections, and frankly, this form of regulation has made it so that vaccine companies can produce enough vaccines. Vaccines are not a profitable business venture, especially for some of the common diseases. So if in the private sector, this is not a place where there's necessarily been a lot of private sector funding available for vaccine research. That's why things like the National Institute for Health have been so important. That has been a federal funding investment that has created the conditions to do the research necessary. And some states are now looking at the changes that are happening at the federal level, and they're banding together. California, Washington, and Hawaii are kind of a unit to make their own vaccine recommendations. And they're basing those recommendations based on what the major medical associations say, rather than the FDA and the CDC recommendations. That is an absolute sign that there are states and medical professionals who no longer trust that the opinion of the FDA and the CDC will be scientifically valid or will be protective of public health. Some states like ours are issuing executive orders to make sure that people still have access to certain vaccines, and trying to make sure that there's still coverage for people who want those vaccines if they have insurance. It really has been, insurance plans are also kind of concerned about this. The Trade Association for the Insurance Industry issued a statement this week saying it's going to cover all ACIP recommended vaccines that were recommended of September 1st. That's important because their meeting was yesterday and is continuing today. So that means that they are picking a point in time before there were any changes to the vaccine schedule as the time frame to say we are going to cover all of these things. And if you're wondering why the insurance industry would be concerned about this, well, hey, if they don't have to pay for something, isn't that good? No, the insurance industry has been very clear that it is a lot more cost effective to prevent disease or to reduce the amount of illness, the seriousness of illness. That is much more cost effective than paying for hospitalizations and treatment. So it makes sense that the insurance industry is also trying to figure out a new landscape where some of the things that had been fairly stable, where there was clear actuarial benefit, what does that look like in a space where perhaps we will end up having fewer people overall vaccinated or able to get vaccines? Survival Coalition is having a press event next week, Wednesday. And I think the tone of this press event has changed a little bit based on some of the comments that were made this week, specifically about homeless people, and then by homeless people with mental illness. But there has been an increasing pattern over the last 8 months of language coming from elected leaders and appointed leaders that has been pretty disturbing to a lot of people with disabilities and families, and really labeling the population as having less value or higher cost than other parts of the population. So Survival is trying to have an event that talks about the impact of that rhetoric and our concerns about where that language is going to lead to. We have one more day on Survival Coalition survey. We're getting some great results, and I will tell you that we will be putting together the results of this survey into some nice graphics and one-pagers, pulling together some stories. Some of the responses are just very telling and very powerful. So help us create the best product that we can. This is the last day to take the survey. So if you or members of your folks, your organizations haven't done it yet, let's get them in. I think we're going to have some really powerful data out of it that hopefully will be useful to all of you as you continue on your work. All right, let's get to Congress. Here's our little timeline that is, when you look at it, this is less than 3 months now. Lots of things in here. So we're going to talk a little bit today about the immediate crisis, which is whether or not we keep the government open. And we now have, as of Thursday night, 2 versions of a continuing resolution bill, one from the Republican side, one from the Democratic side, and a lot of maneuvering that may or may not put us in the position of being in a shutdown. We're going to talk about what it would mean if there is a shutdown. Remember, we're at September 19th now. Next week, Congress is off. And as of this morning, it looks like the Senate might not come back until the 29th of September. So essentially, the votes that happen today only leave less than 48 hours for Congress to get it together when they get back from vacation to avoid a shutdown. There's also some discussion about whether or not the ACA subsidies will be extended, and will they be extended in time, frankly, to avoid potentially people having to make different choices on their plans or leave the market altogether. And then, of course, as we move towards the last day they're doing business in December 18th, there's a lot of other issues that are packed in here. So let's get started with continuing resolutions. There are 2 different versions here, and I have posted articles so you can read a little bit more about each one of them. The Republicans this week released their plan, and it is a fairly standard plan in terms of these documents that we have grown used to seeing. It maintains all the current funding, everything that the discretionary part of the government is doing at the same funding levels through November 21st. So that would mean that they are setting the next crisis point for we have to do something or the government shuts down to essentially 7 weeks from now. Still not a long time, but it's kind of things as they are until that date. There are a few adjustments and increases that were requested by the administration that were included, including an upper to the Women, Infant, and Children program, which is a food assistance program. Note that is not the same as the SNAP program, so it's a much narrower eligibility. They did increase funding for security for Congress the judiciary and administration officials, about $58 million, I think was the price tag for that, might be a little bit more. That is in direct response to the assassination that occurred last week of conservative influencer Charlie Kirk. So Congress has said we do need to up that particular area of spending. On late Thursday, the Democrats revealed what are their asks. Remember, last week we suggested here are some things that you could ask your congressperson to make part of a continuing resolution, and we still have that list in here today. The Democrats' offer is slightly different. The funding deadline that they set is shorter, October 1st. Like the Republican proposal, it keeps funding for federal agencies the same, except that everything that they have negotiated already through the budget process, they want to lock in for the 2026 budget. So it's not just saying we're keeping 2025 levels the same. It's saying all the work that we did as Congress, wherever there is bipartisan agreement on what to fund at what level, that should be locked in for the full year. The proposal also permanently continues the ACA subsidies. It undoes some of the Medicaid cuts and other cuts to healthcare funding, and cuts that were made to public broadcasting as part of the rescissions bill that passed this summer. And it also has a clause that says any funds that are being held by the Office of Management and Budget, they can't do that anymore. And also some language about you can't use this time to essentially impose what the president's budget wants if there are cuts to programs. I'm going to be honest, most watchers do not see that there is any way the Democrats' version can pass. And what is happening is that the U.S. House is scheduling a vote this morning on the the Republican version of the CR, the continuing resolution. So keep everything the same until November 21st with a few uppers for security, et cetera. That is expected to pass. Remember, the Republicans can only lose 2 votes if they want to pass the continuing resolution with only Republican votes. They probably have lost 1, and there are a couple of Democrats that have not been public about how they are going to vote. So most watchers think that the Republican version of the CR will pass the House today. They will not be voting on the Democratic version. The U.S. Senate will also have a vote on both versions of the continuing resolution. And remember, in the Senate, it takes 60 votes to pass something. So the Senate is kind of doing a show here to have the Republican and the Democratic version of the continuing resolution go up, and both of those are going to fail. The Republicans don't have enough votes to have their version pass, and neither do the Democrats. So it's kind of proving in the public sphere that neither proposal has the votes to pass the full Senate. This morning, the Senate is also saying we may not come back next week. And so the first opportunity that they would have to vote again on a continuing resolution would be September 29th, one day before the authority for federal funding to be spent expires. So what this is turning out to be is the House is fairly confident its version will pass. The Senate is fairly confident that neither version will pass right now. And the House version, if it passes today, will be the up or down vote when the Senate comes back. And so it will be a clear, here, we either pass what the House has done, or we shut the government down, because neither of the ideas The Senate was clearly unable to agree on either of those ideas. So it becomes a much clearer up or down vote on whether funding for the federal government continues. Now, this feels very dramatic because it is, but we've also been here before, and not that long ago, most recently in March of 2025. Congress hasn't passed its appropriation bills on time in decades. None of that is unusual. It's not unusual for Congress to keep passing various versions of continuing resolutions as they keep negotiating. And recently, sometimes the continuing resolution becomes the federal budget because that's all they can agree on. The threat of a government shutdown is a strategy to leverage the majority party to make changes the minority party wants. Because if the majority party wants to avoid a shutdown, the idea is you need to give us something, to do that. So when you look at the two versions of the Democrat and Republican continuing resolutions and see that those are differences, the minority party, the Democrat, is saying, we want these differences to be included in your bill, and then we would vote for your bill. The other thing that's happening here is shutdowns are used by political parties to create messages to potential voters, and essentially assign blame to the other party for the reason why there's a shutdown. So in the coming few days, as we get closer and closer to September 30th, you should expect to hear different messaging coming from different parties about who's at fault and why the shutdown is either necessary or a bad idea. And I've kind of put together here a little comparison of what I think you could hear in the coming days as a reason for one party to say, we're the reasonable people, or another party to say, we are doing this because the other party is unreasonable. It doesn't change ultimately the impact of a government shutdown, in the sense that, either you're going to continue funding the government or you're not. That's kind of a toggle switch. It's on off. But I think that both sides have positioned themselves to have this argument about, is it more prudent to keep funding the government as it is now and delay decision making on things that the other party says are critical or important to do very quickly? Is it important to say that the behavior that we have seen in terms of freezing or impounding or taking back money that Congress has appropriated is not addressed enough in the continuing resolution, and that somebody has to say, Congress has a duty to make changes so that the overreach that is happening does not happen anymore? These are the kinds of arguments that you're going to hear in the next few weeks. So some of the items that we have suggested anybody can talk to their member of Congress about, in terms of in the continuing resolution or a final budget bill, here's a list of some of those things that we think are important to people with disabilities, or to the guarantee of, if money is appropriated, it is going to get to where it needs to go. And this is not an exhaustive list, but it comes from a lot of different sources. Some of those items are in the Democratic position. Some of these items are things that are of interest to the Republican caucus. If you're looking for something to do, there's no reason that you couldn't contact your members of Congress and say, hey, these are the kinds of things that I want to make sure are addressed in the next federal budget. And I think the question to ask is, are you going to put these things into a final budget bill? And what are you going to do if the administration withholds money from states or programs? So now that we're getting pretty close to either a shutdown is going to happen or not, I thought we could spend a little bit of time on what does it mean if the government shuts down. And again, we've been in this position before. We've had government shutdowns before. Some of them have lasted a very short amount of time. Some of them have lasted longer. If a shutdown occurs, the longer it goes, the more of an impact there is. But it's also important to know that not everything stops. Most of the spending that our federal government does is in the category of mandatory spending. And a lot of that is really important spending to people with disabilities. So Medicaid, Medicare, Social Security, they keep going. So folks that rely on those programs, no, you can continue to use those programs. You should continue to receive those benefit checks if you get them. Those things are not impacted by a government shutdown. We also continue to pay our debt in the country. And there are some programs, thinking about like that grant that was awarded over 5 years, where, there are programs that are funded for multiple years, not just 1 year at a time. And those programs can continue operating if they continue to have money that was appropriated before, right? So we're not talking about everything in the government stopping, but we are talking about a pretty big pile of things, about 25% of what the federal government does being directly impacted. And some of those things are important to people with disabilities. Agencies and programs that have funding approved every year in the federal budget, stop. Everything that is in those 12 appropriation bills that we keep talking about that Congress has to pass as part of the budget process, that's the discretionary part of the budget. Those are the things that would be potentially impacted by a shutdown. And there are some pretty important things to people with disabilities. The U.S. Department of Education, for example, lots of things that are funded under the Department of Health and Human Services, including disability and aging services, grant programs, and those sorts of things. The USDA, lots of different agencies are in that bucket of things that are considered discretionary and would be impacted by a shutdown. And when the government shuts down, it really means workers who rely on federal funds stop getting their paychecks. Now, let me explain a little bit more about that. Yes, that is federal employees. So federal employees, and there are federal employees across the nation, they're not only in one location, may be told that they are furloughed, or they may be told they're furloughed and they're not getting paid, but they have to come into work anyway. However, states also rely on a lot of federal employees to distribute funding, to make programs run, those kinds of things. And there are lots of employees in states, at the county level, at the state level, that are funded with federal dollars. So if the longer there is no new appropriation for those federal dollars, the more uncertain it becomes. And obviously, the longer the shutdown occurs, the bigger the impact keeps growing over time. When there's a shutdown, the Office of Management and Budget, who we've talked about quite a bit over the last few months, gets some extra discretion about what to do, what government functions have to stop and what can continue. So every agency actually is supposed to have a contingency plan on what to do in the event of a shutdown. But Office of Management and Budget is kind of the one who manages those plans, and they can make decisions about which federal employees do not or have to report to work during the shutdown. That discretion that Office of Management and Budget has is really one of the reasons in March that Democrats were very nervous about what shutting down the government would enable the administration to do. And remember, during that time, we had a lot of activity of cutting programs that Congress had approved funding for through the DOGE and other activities that was again unprecedented and is continuing to be challenged in the courts. The courts have not gotten through all of the items that are being challenged that happened in March, for example. So the Democrats were very concerned in March that if they shut the government down, it would enable the OMB to do more. But they did pass the continuing resolution in March, and their argument is that hasn't stopped the administration from using impoundment, discontinuing funds that have already been awarded, delaying funding streams, or requesting rescissions, in conflict with how Congress said the funding should be spent. So I think in this sense, the argument that the Democrats used in March for keeping the government open, they would say has been proven to not have been a valid argument, given that the behavior they were worried about continued. It doesn't mean that OMB won't have greater discretion under a shutdown, if that in fact is what happens. The other thing that is kind of floating in the air, and you can see it in the Democrats' continuing resolution, is will Congress do something to extend the Affordable Care Act marketplace subsidies that keep premiums low? The Democrats are trying to use the impending shutdown deadline as a way to get those subsidies handled now within the normal budget process. The Republicans are saying we don't need to do that now. We can do that later. We have all sorts of time before the end of the year to do that separately if we choose to do it. And there are some Republican members of the House, who seem to be interested in extending the subsidies. There is a bill that was introduced by a pretty small group of people that would continue existing subsidies for one more year, which puts the expiration date again at a different point in time after the midterm congressional elections in 2026. It is really unclear whether that proposal to just continue doing what is current law has the support to pass. At least in the House, there are many Republicans who are opposed to extending the subsidies, partly because of the cost. It does cost something to do that. And there was just a recent revision of what that cost is by the Congressional Budget Office this morning that puts it at $350 billion over 10 years. There's also Republicans who do not think that the current way that subsidies are awarded is very fair, or that there are abuses that they want to address. The U.S. Senate has been talking about its own plan, although nothing is public yet. And they are less inclined to want to just continue doing what we're doing now. They want to make some policy changes as part of extending the subsidies, which probably means fewer people will qualify for the subsidies, or perhaps those subsidies will not give as much back to people. And there are senators who do not support extending the subsidies at all. So I'm saying this because you may be hearing language about, well, we're going to do a health care bill, after we do the budget. And remember, we have till December 19th to both do a budget and do this other thing. But you should know that there isn't agreement about what to do or whether to do anything at all on the Republican side. So when our Democratic messengers are trying to get a permanent extension of the current subsidies, they are actually going farther than what the small group of U.S. House folks has proposed, which is just continuing for 1 year. Saying, no, we should not have this argument again ever in the future. We should just permanently do this. There's a lot of space between those viewpoints. Do nothing at all, permanently do the thing we're doing now. And we have a few weeks to figure it out. I have a couple other timelines in here for you, because some people have said they like timelines. So these timelines, I have 2 slides of them, are also pointing out different deadlines that the July 1st HR1 has put into place for states to implement certain things. And here's what I want to highlight. Okay, federal government, either we're shutting down or we're continuing it past September 30th. We've talked about that. The other thing that's happening on September 30th is that the USDA is issuing guidance to states about how to implement the SNAP cuts and the changes to the SNAP work requirements that were a part of HR1. And you might remember that there was no implementation deadline in the bill, which essentially means the date the bill was signed becomes when states were supposed to be doing those changes to work requirements and other things. So now we're getting the guidance about what USDA thinks that those changes in the law actually mean for states, and more clarity about when they expect states to do things. So it's about to start getting very real with how do you actually implement the SNAP cuts that are supposed to be in effect. The other thing that happens October 1st as a part of HR1 is the threshold for what's considered an error in SNAP changes. It gets lower. And that, you might remember, the amount of errors, the percentage of errors determines whether or not states in a couple of years have to pay a large match, a lot more money to keep federal SNAP funding coming in. The other thing that is worth noting is, even though Congress thinks it has until December 18th to either decide to extend ACA subsidies or not, insurers have had to figure out what do they need to charge people who are on marketplace plans and premiums already. And we've talked in months past about more and more insurers in August trying to figure out what their rates are for next year. November becomes the first time when current ACA marketplace policy holders are going to get noticed about what their costs are for next year. And they have to make decisions in November about what to do, because that's the open enrollment period. Now, not all of the increased costs are going to be because of HR1. There are some policies that changed and an administrative rule that's still in litigation that impact, the projections of costs. There's also just healthcare costs are higher, and some concerns about how drug costs might go up because of tariffs. So, there is other cost that is going to be an increase regardless of whether the subsidies are, remain in place or disappear. However, people who have to open enroll aren't going to know that, and neither do insurance companies. They have to plan like the expiring subsidies are in fact going to expire, because Congress hasn't done anything different. If they don't do anything different by November 1st, that is the insurers are going to have to, let people know, here's what the cost will be, as if those subsidies don't exist. And that will impact, what kinds of plans people choose, whether they choose lower cost plans or plans with higher out-of-pocket costs, or whether they leave the market entirely. If the Republicans' CR passes, we have another deadline of what do you do about the federal funding for the federal government in November, and just before Thanksgiving. And then, of course, we're moving very rapidly into December, where you either have to make a decision about subsidies or sequestration or not. Moving into the next year, which is now not that far away, June is an important deadline, because that is when the Centers for Medicaid Services has to tell states what they have to do to implement the Medicaid prove you're working or exempt requirements. In August, again, regardless of what happens to the subsidies, if they do get extended for a year, we're going to be in the same place we were this year, next year in August. Because again, if you set a expiration date for subsidies at a different point in time, insurers have to calculate based on whether those subsidies, assuming subsidies don't exist. So we have a kind of redo of what we saw this summer. In September of next year, this time next year, states are going to have to start communicating with people impacted by Medicaid prove you're working or exempt requirements that are going to go into effect January 1st of 2027. Again, we have the same budget process that we have had this year, which will probably be similar to what we've seen in years past. It will be contentious, and I just would predict that we might be going up to the edge of a deadline and not have a budget, because that's been the routine for years. And then November 3rd are those midterm elections. So, these are really important points where some of the things that were signed into law July 4th this year are going to be impacting, us before those midterm elections. And certainly, there is work after those midterm elections by the members of Congress who are in Congress now, where they can either decide to do something different about the marketplace or not. And by the time we get to January 1st of 2027, there are a couple of big changes from HR 1 that go into effect. First, the states get a lot less money to run their SNAP programs. We start reducing our funding for how much it costs to reduce or to run SNAP from the government paying 75% to paying 50%. January 1st of 2026. In 2027, that goes down again to the federal government only paying 25%. And we also implement those prove your working requirements for Medicaid. Now, 2027 sounds really far away, but it isn't, because we're almost at 2026. The other thing that is changing the landscape, and many of you have said over the last few months that you're finding it very difficult to get a hold of or meet your lawmakers. For the last several sessions, there's been fewer and fewer open town halls or places where anyone from the public, any constituent in their district, can come in and get some time with their legislator. I think the recent assassination that we have just seen, and assassinations, because there were some Democratic lawmakers that were killed in August, have really put a damper on lawmakers wanting to hold public events for constituents. And for some of them, this may be the excuse that says, okay, I don't have to do this. But for others, it is kind of reinforcing some of these new methods, teletown halls, invite-only events, where it's easier to control and who can attend and participate. And that's a challenge for constituents, because if it enables lawmakers to perhaps create conditions where they're only inviting or hearing from people who may be expressing or reinforcing views they already hold, as opposed to people who are really trying to raise concerns that the legislature may not have thought of. So I think in the next, few months and years, it will be important for constituents to kind of find new ways to get their messages across. It may mean in-person meetings. It may mean thinking about engaging with candidates with questions. And certainly there are disability advocates who are thinking about those things, and hopefully we will have some ways to help constituents engage soon. Moving to the administration, some of this is not new news, but it keeps coming up because the impacts are becoming more real. So there's a recent article here from Kaiser about what is the impact of cutting almost 40% of the Office of Civil Rights staff at the U.S. Department of Education. There are lots of people who feel like their school districts have not done what they are supposed to for the students with disabilities under IDEA, and now really don't know if there's any willingness or any authority left for them to get what they need from the federal government. So this is not a new issue in this in that sense. It's been covered before, but if you are looking for something to share that kind of continues to say, hey, this is now starting to have real impact and real effect on people with disabilities, I think it's a good article that that illustrates like what are the consequences when you have a federal government federal agency charged with oversight that is no longer has enough resources to do that. And it's important to remember that those federal laws that exist to protect disabled children emerged because the states weren't doing their job to begin with. This week, we also had a kind of blockbuster hearing on Capitol Hill. The Centers for Disease Control former chief, who was just confirmed by the Senate, I think a little more than a month ago, was fired by RFK, ultimately the president, but RFK did not want her in that position. And the US Senate committee called her back to talk about why. She was fairly public about wanting, why she left the CDC, and really raised the alarm that the reason that she was fired was because the secretary wanted a commitment from her to agree with any recommendations that, especially the vaccine advisory committees that had been changed to be more representative of anti-vaccination views, were going to make in advance of them making them. And the hearing did seem to confirm that the rumors of will those committees make changes to existing protocol that was established by science is in fact something that they expect to take place. So if you want to watch the full hearing, there's a link to it through the article. There were many, many things said. I think the big takeaway is this person has said, I left because I was being asked to pre-approve or go along with that recommendations that had no scientific backing or validity, and that might have an impact on people's health, and I was unwilling to do that. Speaking of that vaccine panel, which we've talked a lot about today, it's meeting yesterday and today. And yesterday it recommended against the combined measles, mumps, rubella, and chickenpox vaccine for children younger than 4. That has been part of the childhood vaccination schedule for many, many years, long time. So they did a couple of things. They said, well, we should have two different vaccines. It looks like kids younger than 4, we're not recommending the combined vaccine. But if you're over 4, maybe you can get it. And interestingly, this is highly unusual. They did allow to let the Vaccines for Children program, remember that very important program that governs what can be covered under Medicaid and CHIP, to continue covering the current combined vaccine for kids under 4. So it's kind of, if you're confused, you're not alone. That is a very odd thing to have said. We're not recommending this vaccine, and yet we're allowing the same vaccine to continue for the group we're not allowing anymore. If you're confused, you're not alone. Today, this committee is also going to vote on a more controversial recommendation that would remove entirely the hepatitis B vaccine from the childhood vaccination schedule, and also limit use of the COVID-19 vaccine. The removal of the hepatitis B vaccine, which has been in place for 40 years. And if you want a really good article about what life looked like before that vaccine, Jonathan Cohn has a pretty in-depth look on what was the difference after that vaccine became part of the universal schedule. That is important because that would test out removing a vaccine from the recommendations does call into question, okay, what does that mean for the Vaccines for Children program and what is covered under Medicaid, and test the question of whether states can choose to continue to cover that vaccine, even if it's not part of what's included in the Vaccines for Children program. Doctors are not happy about this committee's decisions. They are very concerned that both the change that the committee already voted on about the combined MMRV vaccine and proposed removal for Hep B vaccine isn't backed by scientific evidence. They're worried it might hamper access for kids to vaccines and limit insurance coverage. So the medical community has been fairly consistent that they do not agree with the changes that this committee is making. In other news, we've talked before about the intent to revisit the debunked research that I don't know how many millions of dollars have been invested into testing and researching a causation between autism and vaccines since the 1990s. It's been a lot. There's been research across the world that has been conducted over decades, and all of those studies have come up with there isn't a causal link between autism and vaccines. However, it does appear that the government is going to give a no-bid contract, and what that means is basically it's a guarantee that the entity that's named is going to get the money to do the research. They are going to give money to a university to, again, investigate whether there's a link between vaccinations and autism. And it doesn't say how much money they're getting in the notice or exactly what the researchers intend to do. But it does look like they are looking at a university that has done work before, with linking data between mothers and children and looking for patterns. So unclear what this project actually is, but again, it is confirming what we have been hearing over the last few months, that there is a desire to kind of revisit these theories that have been the subject to a lot of existing research, and where that research has been very clear about there is not a cause. We have talked a little bit before about executive orders related to crime and homelessness, because there has been rhetorically a link created with homeless people and being people with mental illness. This is a different flavor of kind of a similar scenario to the grants that we have been watching with the U.S. Department of Education. And it's important not because it's directly related to people with disabilities, but it's important because it kind of shows that there is an emerging pattern where federal agencies are trying to impose conditions that really control either who can apply for the money, what those applicants may do that maybe the federal government doesn't have a lot of control over. And this is this particular set of grants is now the subject of a lawsuit. So the worry is that the conditions that federal agencies may be writing into their grants may be asking potential grantees to follow certain ideological positions or run their operations or hire or not hire staff with certain characteristics. And it is another example where this set of grants, which of course expires on September 30th, so there's some urgency here. The money has not been distributed, which is another pattern we've seen. This set of grants, there was actually a competitive process last year under the Biden administration that went through and awarded the funding, and the funding was never distributed. by the incoming administration. The Trump administration then ran a second competitive grant process, and it actually notified members of Congress of who won in August. And then the money never got to where it was supposed to, and the official letters of award never went out. So by all accounts, it looked like the Trump administration had run its own process, months later after the first Biden process had been awarded, and then they never awarded the money again. They started a new competition with a very short time window to apply, obviously because the money expires on September 30th. And then this new application imposes a number of screens that are not something that applicants can control, that they are trying to really narrowly define who is eligible for this money through the conditions of the grant. And that criteria is often not something that the applicant can control. For example, are you within a city or county or state that is not enforcing homeless encampment bans or other things? The long and short of it is, the people who thought they got the money haven't gotten the money. And the new application process, the conditions are stringent enough that there's really only 9 states that have homeless programs that could comply with the new grant requirements. Also last week, there were a number of there was some publicly made comments by a Fox News host, and I have put the quotes in here that really connected homeless people as being mentally ill. And I think the important piece of this quote is the idea of whose choice is it to compel or force an individual to seek the treatment that the person who, and who's making a decision about what that treatment is, or what's going to happen if you don't take it. So this is a pretty alarming bit of language that says, hey, somebody outside the individual is going to be the decider, and we're going to decide what is appropriate for you and what the consequences are if you don't do what we think is appropriate. The next statement was far more pointed, that said, hey, the solution here is involuntary lethal injection. For those of you who are paying attention, that's a big fancy phrase. It has lots of syllables and multiple words, but it really means one thing. It means murder, and that somebody else outside the individual gets to decide whether or not that happens according to their own criteria. The other piece that is interesting is it took about 3 days before folks responded and went, whoa, this doesn't seem like something we should be hearing. Like, this seems like something that really hasn't been said out loud before, and it fits in a pattern of many other items where people with disabilities have been not valued equally as other members of the population. And this takes it a step farther by saying, hey, we're creating a permission structure where there are certain kinds of people that maybe somebody else should be making decisions about. I don't know what to say about that, except that there are lots of folks with disabilities really noticed. And again, that connection of homeless equating to disability, now equating to, we can do things to you if you are homeless. And one of those things that we can do is involuntary lethal direction. I think there's a lot more people connecting a very straight linear line to those things. One good thing, our US DOJ is suing Uber for discrimination against disabled riders. And this has been a persistent challenge that many people in the non-driver transportation community have been noticing. Ride shares are often promoted as a solution for folks who don't have their own vehicles. For many years, especially folks in the vision impaired community have said, hey, I call for a ride, but the ride doesn't want to pick me up if they see I have a disability. And now there is a federal lawsuit that is, making those same, arguments that one particular company has been doing that as part of a pattern. A particularly good article about the impact of the reconciliation bill. I was on a call Wednesday where there were a number of states that talked about various impacts they are already seeing. This is a larger and more global article, but I think it is important that a lot of folks have been kind of sending the message that, well, all of these changes in HR 1 are going to happen some far time in the future. And this article says, no, there are going to be a lot of things that people feel that happen much sooner than that. Some of which we have talked about in these webinars before. We know state legislators are going to have to decide what to do as they get budget holes. We also know that there are lots of hospitals and health plans and other things that are now making decisions about what to do in this new landscape because they have to assume that these cuts are coming. Even if they are in the distance, they have to make changes and decisions now, knowing that there's been a change in law and what the plan is. So what are some of the things that in the next year before the midterm elections, November 3rd, 2026, people might expect to see? The first thing, which has gotten most coverage, is whether or not those ACA marketplace subsidies or the benefits for those marketplace plans change. And remember, the subsidies is what wasn't included in the HR 1 bill, but there are also some policy changes and other changes that do impact the marketplace that were a part of that bill that are going to go into effect no matter what. The subsidies get a lot of the airtime because it is a big driver for really big increases in premium as soon as next year if Congress doesn't do anything to extend them. And remember, there isn't agreement about whether or not to do that at this time. The important piece here is whether or not what Congress does. If they don't do it soon enough, people have only about a month to open enroll for their insurance plan next year. And that means that even if Congress does something different in December, people are going to need to select plans without knowing whether the higher premiums will be offset by tax credits. And that will influence and drive decision making, because when you see that your premiums are going up by, on average, 75%, I keep having this argument with folks. The tax credits get you money back at the end of the year, right? Which is fine. That's how a tax credit works. But if you don't have the cash flow to be able to afford the premium every month, it gets really hard for people to go, well, I'll get that money back at the end of the year if they can't afford to pay the premium every month that is in front of them to get to that end of the year. So lots of folks will have to decide about, do I select a lower cost plan that covers less? Do I select a plan that has lower premiums, but I'm on the hook for more bills if I get sick? Or do I go uninsured? And they are making those decisions in November, potentially without knowing whether or not the subsidies are going to be extended. If a lot of people leave or they choose lower cost plans, we may have a scenario where even if the subsidies are extended, the risk pool has changed, right? Insurance pool and the marketplace relies on many people who don't have a lot of healthcare bills paying premiums to offset those folks who do have healthcare costs that are high. And the goal is that you have a diverse enough group of people in the insurance pool that the insurers know how much to charge every person by premiums, and that the revenue they get in from premiums is enough to cover the healthcare costs for everybody, the high cost people and the low cost people. Well, if you have people who are paying lower premiums and or leaving the marketplace, all of the folks who really need the insurance are still there, who are using the insurance, you still get this cycle of the pool is changing, which is going to drive up premium costs next year, regardless of whether the subsidies are extended. The second thing that is happening now, lots of healthcare providers, including hospitals, but not only hospitals, are making decisions about what to do, knowing that there are cuts that are coming. And some of those health systems are pretty aware of which services are not money makers, where they lose money. Things like maternity care, behavioral health, trauma centers, things that are already hard to come by in some areas, especially rural areas. Those are the things that might be where there might be a decision to stop doing them first. They don't have the luxury of seeing whether or not those cuts will be reversed, or if state legislators will provide additional funding. So health systems are really looking at, how do we, in this scenario, reduce our costs? And sometimes that's reducing services, sometimes it's reducing staff, sometimes it's consolidating, what they do where, and all of that impacts access to people. The other pieces that are ongoing, and we've talked about this probably the most in these webinars, is the changes to Medicaid. Yeah, they're beginning after the November elections, not much after. And a lot of the work that has to go into implementing some of those things, like the prove you're working or exempt requirements, has to happen in 2026, even before the elections. So, this is another example of, regardless of what the election results are, regardless of, what happens, you are not going to have a Congress, assuming this current Congress that passed and has supported all of these changes in HR 1, it is unlikely that they are going to undo some of the cuts that are going to be made or implemented in January of 2027. So states have to go through and plan and invest and do all of the work to go live on January 2027. And that is not going to be different, before the November elections, and maybe not after. The other thing that's impacting states, and you've heard about this a lot, there's going to be big budget holes that come from a variety of places. The cuts in SNAP are one, the cuts in Medicaid are another, but there are other federal funding streams that we may think are coming in that may or may not be part of the money that goes to states. And another article that's saying, hey, there's lots of ways that states are thinking about reshaping specifically their Medicaid programs to make up for budget shortfalls. And that does mean paying health plans less, cutting optional services, and they mentioned home and community-based services in there as being one of the likely targets. On my call this week, there were several examples of states that are already making changes to their Medicaid programs, anticipating the cuts that are coming in HR 1. Idaho is one such state. We talked about North Carolina having to, their state legislature did not approve the extra funding they needed to do what they're doing now. And so their response was cutting provider rates. Colorado had an immediate shortfall because of HR 1, and one of the strategies that they included was cutting provider rates. This is a third state where they are reducing reimbursement rates as effective at the beginning of this month across the board for all provider types. And this is a rate reduction that is being done in advance of the state's budget. And the Medicaid agency is saying, we don't want to wait for the state legislature to change the budget, because, if we wait and keep spending, Medicaid dollars as we are now, we think we're going to have to reduce rates even more than 4%. Kansas is looking at establishing wait lists. They have 6 waivers that are deal with different populations of people with disabilities and older adults. So again, they are a different states than they're unique, as all states are. But again, this Kansas legislature did not approve additional cost to continue money to fully fund some of what they're doing now. And 3 out of their 6 Medicaid waivers that help people with disabilities, I have them listed here, are likely to not have enough money. And for the first time, we'll have wait lists for people who are eligible to be in those waivers, but can't get in because there's not enough funding to support the care that they would receive. Kansas has other disability waivers, including one for intellectual and developmental disabilities that currently have lots of people on the waiting list. So this is an example of a state that already has waiting lists for certain waivers. And now, because the legislature isn't providing extra money to accommodate the people who need the help, there may be waiting lists in more waivers. And it looks like their leadership in the state legislature is telegraphing that they want to cut even more from the Medicaid program. So that is all in advance of the impacts that are coming from HR 1 to that state's Medicaid program. Michigan is another state that was mentioned on the call. It again has not passed its budget for next year yet, but the House, Michigan State House, has passed its version of a budget, and they are cutting their Medicaid Health and Human Services Agency by a significant amount, including a specific cut to the administrative portion of their direct care agency rates. That's about 20% of the Medicaid funding that's going to direct care services. So Michigan has kind of an unusual situation where they fund the administrative part of the rate, and I think the amount to pay workers separately. So the cut is entirely coming from the administrative part of the rate, which is all of the money that agencies use to run and operate and schedule and hire and recruit and do the administrative paperwork and the things that are required of the Medicaid program to get successfully reimbursed and prove that there's no fraud, all of those things. That's part of the administrative work the agencies do. So that means that a lot of provider agencies have to take a pretty big cut in the money that they use to run their agencies. And a lot of them are saying, hey, we can't do that. Like, we will go out of business if we have to make that level of cut. For the Trump administration, they have not been particularly clear on whether they are supportive of extending the Affordable Care Act marketplace subsidies. Obviously, they weren't pushing to have that included in the reconciliation bill. And they have not had a strong opinion with Congress that that's something that they should do this fall. But one thing they are being clear about is, hey, if the premiums go up, there's a solution. We should have more people pick those plans that cover less and make the consumer pay more if they have to use healthcare. So there are currently plans that are called catastrophic plans sold in the marketplaces, and they do have a pretty high cost. It requires people to spend more than $10,000 a year on deductibles before the policies kick in. They have lower premiums, and that is the administration's solution to the premium increase, is to direct people into these plans with lower premiums that do not cover as much. Again, we just talked about the worry of, if you have more people in these catastrophic plans, how does that generate the revenue that is needed to pay for the higher cost people who are paying more and higher premiums for other plans? Or do people just say the catastrophic plan is not something I could do, and they leave the marketplace? I'll let you read, the balance of this article here. But I think that this is a deliberate strategy that the administration is touting as almost a reason why you don't need to extend the subsidies. If you promote that this catastrophic plan is a solution to not doing the subsidies, then it provides a justification that Congress can let them expire, which is what HR 1 has done. In the vein of states making decisions about small healthcare programs, this article from California is showing how programs that are deliberately designed to recruit rural healthcare workers are at real risk because of larger cuts that are coming because of HR 1 and state budget deficits. So it's another kind of tertiary, that's a big word, but like not a direct impact, but a secondary impact of these larger cuts to healthcare is that some of the various things that states have promoted and established to address the real problems of access and professional expertise, especially in rural areas, may be the first things that go in a wider conversation about not having enough money to run healthcare systems as they are. This week also, the Centers for Medicaid Services released the application process for the $50 billion rural healthcare fund that was included as a part of HR 1. And for those of you who have been following, this $50 billion fund is distributed over 10 years. It is not expected to cover the losses of money to rural healthcare systems. There was an estimate of about 30% of the estimated cuts to federal Medicaid spending in rural communities are being offset potentially by this fund. There have been a lot of delays and no guidance and red tape that are associated with applying for this fund. And I think one of the things that people are watching is exactly how evenly and how much money will states get from this fund. It's a pretty tight deadline to apply, November 5th, 2025, which is not even a month. There's only one application period for the whole period for this funding, and it's now. The law requires states to distribute half of that $50 billion fund evenly across states, but they added a phrase there with an approved application. Now, I think that most states will apply, but if CMS chooses not to approve a state's application, it seems like they would not be part of even though that the law says that the funding will be distributed evenly across all states. Well, that's all states that have an approved application. So it feels a little bit like there's some discretion that CMS is saying, we need to approve the application, and if it's not an application that we see as worthy, then that becomes a state that is not part of that doesn't need to get any of this $50 billion fund. The other half of the funding is awarded at CMS discretion. And there really has been a lot of discussion about, well, what does that mean? Does that mean there will be some states who get a lot more funding than others, and maybe some states that don't get any of the discretionary funding? All of this is unknown, but it will be clear by December 31st of this year, because that is when CMS will make its decisions. And it should be noted that this is not money that is intended to replace operational costs or revenue that rural hospitals are losing. So the what you can spend this money on is fairly restricted, and it isn't actually making up for the cuts, the actual cuts that are coming if there are many fewer people who are insured, or if states are changing their Medicaid programs, or the challenges that come with hospitals who have a greater proportion of people who are using Medicaid, visiting their hospital. And with that, I'm going to stop and let's see if there's any questions. There we go.